Hello class, my name is Joe Garcia. Today I'll be doing my presentation on the peroneus tertius muscle. Okay, all right, so for the origin and insertion, the peroneus tertius muscle is also known as the fibularis tertius. It's located on the lower lateral aspect of the leg and is also inverted by the deep fibular nerve. Right, so for the origin, we have right here in this example, you can see it's originated on the medial surface, distal third of the fibula, interserosus membrane, and it's going to be on the anterior surface. For insertion, it's going to be on the dorsal surface, tuberosity on the base of the fifth metatarsal. And right there you can see on the example on the bottom there. Okay. For movement and muscle action. Okay, so this muscle plays a role in the gait cycle, works together with other foot dorsiflexors during the swing phase to clear the foot and toes off the ground and levels of foot if necessary. Because the peroneus tertius has a weak mechanical leverage, it can only produce two movements. Okay, so the first action it can perform is going to be a foot dorsiflexion, and this is going to be when the foot moves towards the shin around the ankle joint with the help of the extensor digitorum longus and tibialis anterior muscles. Okay, for the second one, we have foot eversion, and that's when the foot moves from the middle plane of the body, okay, at the subtalar joint with the aid of fibularis longus and fibularis brevis muscles. Okay, for movement number one, the leg you step forward with while performing a forward lunge puts your peroneus tertius in a concentric state. Okay, for the second movement, while walking, the foot that is elevated from the ground after the stance phase puts the tertius in an eccentric state. Okay, so examples of daily use. First example I have listed here is going to be when you're kicking a soccer ball, and you can see an example on the right. You can see that her planted foot is slightly everted. So there's going to be many instances during soccer where this is going to be essential in making sure that you perform a proper kick. And also on the example below that one, instead of doing a long kick, he's also using an inverted foot to pass the ball properly. Okay, and then for the second example, so just daily walking, you're going to have at least 10 degrees of ankle dorsiflexion during the stance phase of the gait cycle, which contributes to forward body movement for normal walking. Okay, so for strengthening exercises, right here I have it listed. We're going to be using a towel wrap. You're going to be wrapping the towel around your designated foot, gently pulling back on it, and then while you're applying resistance, you're going to perform plantar flexion with your foot. So you're not going to be using too much force here. And then you're going to be repeating this for around 10 to 15 reps for 4 sets. A good progression of this is instead of a towel, you want to use a resistance band, probably 2 to 5 pounds, not too crazy. And then for regression, you're going to apply resistance and pull on the towel a little bit less. Okay, and this can also double as a stretch. So instead, you're going to be pulling back on the towel and you're going to be holding that. But I didn't list that as a stretch. Okay, so this is an example right here. You're going to be doing that multiple times. Okay, another strengthening exercise I have listed here is seated toe kicks and ankle lift. So first step, you're going to sit in a chair and dorsiflex either foot. Evert the foot outwards towards a small ball. Okay, so just like how the gentleman is sitting right there. So you're going to have the ball on the outside of your foot, and you're going to be everting your foot and hitting the ball, just like so. Okay, you're gonna repeat this for about 15 to 20 repetitions for 2 sets. Progression, you could start using a weighted ball, nothing too heavy, that wouldn't go above 4 pounds. And then for a regression, you can just use a blow up balloon, just anything to use as a target. It's definitely not recommended for people who pronate when walking or running, since this will help increase pronation. Okay, so stretching exercises, eversion and inversion stretch. So for first step, you're gonna sit in the chair with the affected leg crossed over your other knee. For step 2, holding the bottom of the foot with your hands, slowly tilt the sole of your foot towards the floor. Okay, you're gonna hold this position for 10 to 15 seconds and then pull your foot towards you, lifting it to the ceiling, and you're gonna repeat this 10 times. So if this was my foot, you're doing that with it. Okay, so for progression, you're gonna increase the range of motion that you're pulling and pulling and pushing it. And then for regression, you're gonna decrease that range. So that's the example here. Okay, for our second stretch, we have the fibularis teretis stretch, and you can either do this standing up or seated. You're going to drop your foot into plantar flexion behind you. You're going to slightly invert the foot, and then you're going to apply a light pressure until you feel a stretch right there on the front of your leg. You're going to hold this position for about 15 to 30 seconds. Repeat 3 to 4 times throughout the day. For progression, you can reach farther back with your designated leg, so that way you get a bigger stretch. And then for regression, you're gonna wanna sit in the chair, so that way you don't have all this added weight on your leg, and perform the same stretch. Okay, so possible injuries. One of them being a strain. A strain or injury can be caused to the fibularis teretis muscle due to overuse. This is seen in people who are involved with long distance running when they have themselves run on uneven surfaces. Another contributor is from prolonged standing in one place. Many cases arise from people who work as greeters or security guards. So anybody who's going to be standing in one place for an extended amount of time is going to has a potential to strain this muscle. So symptoms. One of the symptoms of the peroneus teretis strain is severe pain in the front part of the leg and outer part of the ankle. You also experience severe pain on the outer part of the heel or severe ankle and instability of the ankles. Okay, so for our treatment, you want to make sure you're getting adequate rest, at least a week of rest where no weight or pressure should be on the affected foot. This allows the muscle to heal and the inflammation and swelling to calm down. The pain will also be controlled during this period of rest. So you can also apply cold and hot packs. Okay, apply ice packs to the affected area for 15 to 20 minutes. You're going to want to do this 2 to 3 times a day. You may also apply warm compresses to the affected foot a few times a day to reduce swelling and inflammation. Okay, so exercises about a week of rest on the affected foot. You may begin gentle stretching exercises of the affected foot to regain lost flexibility and strength of the foot. You want to make sure you're waiting a good amount of time until you feel comfortable doing those, because you don't want to re-injure the muscle. Okay, so that's all I have for you guys today. Thank you.